Fainting, causes and treatment. Fainting, syncope, is a sudden, brief loss of consciousness during which the person falls to the ground or slumps in a chair, followed by a return to consciousness. The person is motionless and limp and may have cool legs and arms, a weak pulse, and shallow breathing. Some people feel lightheaded or dizzy before they faint. Others may have nausea, sweating, blurred vision or tunnel vision, tingling of lips or fingertips, chest pain, or palpitations. Less often, people faint suddenly, without any warning symptoms. Seizures, which are a disturbance of the brain's electrical activity, and cardiac arrest, in which the heart completely stops beating, can cause loss of consciousness but are not considered fainting. However, in some people who faint, muscles briefly jerk involuntarily, resembling a seizure. Fainting can occur in people of any age, but dangerous causes of fainting are more common among older people. Causes of fainting: a person cannot lose consciousness unless brain function is generally disturbed. This disturbance usually occurs because overall blood flow to the brain is reduced. Sometimes, however, blood flow is adequate but the blood does not contain sufficient oxygen or glucose, blood sugar, which the brain needs to function. Blood flow to the brain can be reduced in several ways. Most often, the cause is something that interferes with the normal return of blood to the heart, and thus reduces blood flow out from the heart. Less often, the cause is a disorder that interferes with blood pumping, typically a heart disorder. Although strokes reduce blood flow to the brain, they only reduce flow to part of the brain. Thus, strokes rarely cause fainting except for the few strokes that involve the part of the brain that maintains consciousness. The most common causes of fainting are strong emotion, such as fear, pain, or sight of blood, coughing or straining to pass stool or urine, prolonged standing up suddenly, pregnancy, use of certain drugs. Idiopathic, meaning that the cause cannot be determined. These common causes nearly always cause fainting only when people are standing up. When they fall down, blood flow to the brain is increased, quickly restoring consciousness, although people may not feel completely normal for a few minutes to a few hours. Some people feel tired or exhausted for several hours. These causes tend not to be serious unless people are injured when they fall. Most of these causes involve decreased return of blood to the heart. Strong emotion, particularly that triggered by the sight of blood, or pain, can activate the vagus nerve. Vagus nerve activation widens blood vessels, reducing the return of blood to the heart, and slows the heart rate. Both of these factors cause lightheadedness and sometimes fainting, called vasovagal syncope or neurocardiogenic syncope. Hormonal changes in early pregnancy sometimes lead to fainting. Low blood sugar, hypoglycemia, initially causes confusion, lightheadedness, shakiness, and other symptoms, but if hypoglycemia is severe or prolonged, people can lose consciousness. Because these other symptoms usually occur before fainting, people with hypoglycemia usually have some warning before they faint. Usually, the cause of hypoglycemia is use of drugs for diabetes, particularly insulin. Rarely, people have a tumor that secretes insulin. Evaluation of fainting: if possible, someone who witnessed the faint should provide the doctor with a description of the event because the person who fainted may not remember. Warning signs in people who have fainted: certain symptoms and characteristics are cause for concern. They include fainting during exercise, several episodes within a short time, sudden fainting without any warning symptoms or any apparent trigger, fainting preceded or followed by possible heart symptoms such as chest pain, palpitations, or shortness of breath. Older age, significant injury as a result of fainting. Although most causes of fainting are not serious, a doctor's evaluation is needed to distinguish serious causes from relatively harmless ones. People who fainted should see a doctor right away, especially if they have any warning signs. In general, if fainting results in an injury or has happened several times, particularly within a brief period, more intensive evaluation is warranted. Imaging of the heart and brain are not routinely done unless the doctor suspects a heart or brain problem. People with suspected heart disorders, including heart attack, abnormal heart rhythm, or heart valve abnormality are usually admitted to the hospital for evaluation. Treatment of fainting. Specific treatment depends on the cause. For example, people who have fainting caused by an abnormal heart rhythm may need to have a pacemaker and/or defibrillator implanted. If people see someone faint, they should check whether the person is breathing. If the person is not breathing, bystanders should call for emergency medical assistance and begin cardiopulmonary resuscitation (CPR), including applying an automated external defibrillator (AED), if one is available. Once the person reaches the hospital, doctors will treat the cause of the fainting with drugs or appropriate measures, such as direct current cardiac defibrillation to restart the heart, or drugs or surgery to open blocked arteries. A person who is breathing should remain lying down. If the person sits upright too rapidly, fainting may recur. Doctors may ask a person who has fainted to restrict driving and operating machinery until the cause of fainting is determined and treated, because if the cause is an unrecognized heart disorder, the next manifestation may be fatal.